introduce myself a little bit here. I'm Michael Docktor. I'm a practicing gastroenterologist at Boston Children's. I'm a couple years out of fellowship now, and I've really found a place for myself at Children's, not only in gastroenterology, but also in dealing with a number of things in digital healthcare and health IT, innovation, and I'll talk a little bit about each of those. And we have two Johns on the line, is that right?
Yeah, okay, let me just introduce ourselves, Michael. My name is John Bennett. I'm from Miami. We're hosting the Boston Medical TV. This is our second show. Michael was good enough to come out tonight, and we're also joined with John Hewitt. He's a medical writer from Philadelphia. Say hi, John. Say hi, John.
How you guys doing?
Very good. Okay, Michael, I guess the way we're going to structure this, you've done a lot of interesting stuff. So the first question I'd like to ask you, Mike, is what I ask all the doctors I meet, is that essentially, when did you first notice that you had an affinity for computers?
It's actually an interesting story. So I can remember the first like 386 I had as a little kid, and I took to it pretty immediately, but it really, more recently, shortly after the birth of my first child about 5 years ago, was when the iPhone first came out, and I had always had this entrepreneurial spirit as a kid and even a grown-up, but I'd always found it difficult to actually create a business when you're going through high school and college and med school. But with the advent of the iPhone and the App Store, suddenly the concept of building a business or having, an idea and actually creating it became much more achievable. Mm-hmm. And so I actually got together with a friend, and we hired a bunch of developers, and we actually built what at the time was a pretty cool app, which basically was a motto. It took, not that much money and a lot of blood, sweat, and tears, but we created this app that still, 5 years later, is still on the App Store. But the exciting thing for me was that it really was an entree into mobility, into technology, app development, and my hope was that eventually I'd be able to learn from that experience and apply it into my, the care of my patients and building, apps that were relevant to healthcare and patient care. So that was really the initial entree into it, and I definitely was bitten by the Apple bug, and have since become more deeply ingrained in technology and app development and innovation and all that.
What does that particular application do? The first one you made.
So it basically rewards a child by incentivizing them to do the things that you would like them to do. So, so basically, it's a modern-day star chart. But briefly, it takes a picture of whatever the child desires. So, say Johnny wants a tricycle for his for doing the things that you want him to do. So, for example, if you want him to brush his teeth, twice a day. If he did that, he earned something. So in the olden days, it was a gold star. In this case, we take a picture of whatever his object of desire is and turn it into a jigsaw puzzle with as many pieces as you want to, basically. Mm-hmm. And then for each time that he's done the right thing, you press the jigsaw puzzle, and a little piece flies in and makes a lot of noise, and there's lots of positive reinforcement for the kids, so they see their thing that they want is fully, final reward. So not really medically relevant, but again, was an entree into app development for me was.
But it got your feet.
It can open the doors.
Exactly. Okay, let me just. I'm sorry to interrupt you for a second, Mike. Jack Minos, he's a doctor. He's a doctor from Melbourne, Australia. He's also written an application called HeartSmart. Jack, Michael's is talking about his computer background and how he started integrating the computer into his medical practice. I made the mistake. He's attending at Boston Children's. So, okay, Michael. I guess you kind of probably take the computers more than most doctors, would you say? You use it more than most docs, would you say, or the same?
No, I mean, so at this point, I'd say more. I mean, we all use computers now in every part of our life, from answering emails to our electronic health records. But my push at children's, again, from this early experience with app development, is thinking mobily. So I've been a big proponent of, you know, building, whether it's apps or streamlining, different efficiency gains. Really thinking about a mobile workforce at Children's. So I was fortunately given the role of Director of Clinical Mobile Solutions, which basically means that I'm a clinician that likes to use iPhones and iPads in a way that helps us engage our patients, educate them, and ultimately work towards building apps internally that might externally face, and also bring in external apps that can improve our efficiency and productivity, and again, patient care ultimately. So I use a computer probably as much as everyone else, but I'd like to argue that I'm the mobile guy that's always trying to get people to think more mobile.
Michael, do you give them a core set of apps? Is there like a basic set of apps that you recommend that the doctors use, or?
Yeah, so that's a good question. We've spent some time actually curating some apps. We have an internal web page that has some app suggestions. I think part of what makes the iPhone and iPad and those things, and I'm admittedly very Apple-centric, but part of what makes those unique and helpful in the healthcare environment isn't just the great apps for medical calculators and whatnot, but it's productivity things. It's things like the calendar and email and things that will help make my day a bit more efficient. But I find that I use my iPad probably most often to educate my patients. So I'll pick up a quick YouTube video on a world's expert on pain amplification and show it to a patient, or I'll show them a picture of or a video of a teenage child that has to place their own nasogastric tube. And so that's a really compelling thing to show a patient when you're trying to explain something. It's much easier to show it to them in a mobile fashion. So I'll use a conventional drawing application and just draw on top of an anatomy image and explain, what a colonoscopy is, or what an upper endoscopy is, or where someone's Crohn's disease is active. Mobile devices are very nimble and easy, and I think there's lots that we can do with them that isn't just about apps. But to answer your question, we do have a core set of applications, both apps that we recommend folks use, as well as apps that we've now got as part of the enterprise. So I can get into that if you'd like.
Oh, okay. Just a second, John. Could you do me a favor and turn off your mic because we're getting too much feedback. Okay, John?
Yeah. Sure.
Yeah. Thank you. Michael, how do the patients take to that? How do they take using the iPad and iPhone to educate them? How do they like that?
I've found that my patients are not only appreciative of it, but really impressed. In the olden days, not that long ago, I'd take a pen and I'd draw on the back of a piece of paper, or I'd use the paper from the paper that we pull over the bed, and try my best to draw out the anatomy of the GI tract or something like that. And it invariably failed miserably because people didn't really get it. But I can nowadays pull up, a really beautiful picture of the GI tract, the colon, the small bowel, and the stomach, and I can put it right up against the kid's belly, and it's the same size, and they have, a very good, sense. And they look down at their belly, they can see the iPad with the layout of the colon and the stomach, and I can, draw where their belly button is, and I can draw where their terminal ileum is, where their Crohn's might be. And it suddenly clicks for the families and for the patients. And I think for me, we're as much educators as we are, physicians. And I think that if we can, educate our patients and they can therefore understand what we're talking about and what are the issues that they're facing, they'll be in a better place to actually help themselves and improve their own care.
Yeah, education is complying too. I think they comply a lot more if they
do when they understand. When they understand why it is that they're doing it and why they're having a pain in a certain case, it's really, I've found a tremendous value in, a $2 drawing application is the most valuable app that I have.
Wow. So what's that app called?
I think it's called Art Studio, but use any traditional drawing app. I basically, took a bunch of images off of Google image search. And took a couple other ones that I tend to use, and you can just draw right on top of the image, and it's tremendously useful. There's also some great apps like DrawMD has a whole series of applications for pediatrics, for anesthesia, for surgery, and that's a pretty cool app actually. That does some of the same thing.
Now, Michael, do you find yourself sending the patients home with some certain videos to watch or certain instructions to kind of follow up to more explain? Well, anyways, you send them home with any material?
Yeah, so it's a good question. In future, pediatrics is an interesting space because it's different when you think about adults and managing their own health care. A lot of times, our patients are managed by their parents and their family. So to prescribe an app is a bit more of a difficult scenario. I'm getting a bunch of feedback from someone. So.
Yeah, we got to figure this out. Jack, could you mute your microphone, Jack?
Yeah.
I'm getting feedback here. Let's still get it.
Oh, that's better, I think.
Yeah.
Okay. Sorry, guys.
Yeah.
So as far as I would say relatively few and far between. Sending patients home with either app recommendations or video links or whatever. But I think that as we have better, more secure ways of doing that, and people are using things like portals more, which we're doing more and more of at Children's. Easy ways to deliver meaningful content to patients for education and engagement is something that I think everyone's looking to do more and more of. So I look forward to a time when we have a bit of an easier system to do that, and working on curating the right content to send to them.
Yeah, well, yeah. There's some doctors that with arranging programs where a patient has a certain diagnosis, they're automatically sent home with a preset list of, and they may tweak it, they may individualize the follow-up instructions.
Yeah, no, I think that, truthfully, I don't know if we've talked about it yet, but 99% of the time that patients spend is outside of our clinics, right? So the more that we can do to educate them and give them the tools that they need to survive in the wild, own care, that's really what I would hope to do. So it's certainly an area of interest.
Yeah, well, there's so much going on with computers, and everybody has one. So that's certainly now compared to 15, 20 years ago.
Yeah.
Oh, so Michael, you're involved. I guess you started the Hacking Pediatrics organization just a year or two ago, correct?
Yeah, just last summer actually.
And copied MIT's Hacking Medicine, or you kind of...
Yeah, so it was actually a very close collaboration. So it was myself and 4 of my colleagues at Children's that all co-founded it as a group, and one of our co-founders was Judy Lang, who is an MIT grad and was a founder of Hacking Medicine. So we partnered up with them. It wasn't, it was basically fashioned after their very successful hackathon models.
Okay.
And we, consider them close collaborators and really are the reason why we even got started. But just Hacking Pediatrics for those that might not know, and Hacking Medicine for that matter. Hacking Pediatrics was basically founded last year, and it was really an effort to stimulate the innovation ecosystem of children's, really bringing resources from outside of healthcare into healthcare to help build solutions for children and their families. So, we have a treasure trove of clinical experts, patients and parents, doc nurses. All of them have a real line of sight into what are the problems that they face every day, and some great ideas of maybe some solutions. But what they don't have are the means or the expertise to really execute on those ideas. Mm-hmm. And so what we did and what Hacking Medicine did before us was to bring the right people into the room to help those solutions and those problems become a solution. So we got docs and nurses and therapists together with engineers, designers, entrepreneurs, web developers, and a whole network of mentors over the course of a weekend to take something that was merely a kernel of an idea and a problem pitch, we call it a pain point, and turn those pain points into, arguably potential ventures that are going to build solutions for kids and their families. So last year we had about 175 participants. About a third of them were children's clinicians from various backgrounds. And then we had, a huge number of folks from the MIT designers, entrepreneurs, web developers, and 37 people got up in front of the room Saturday morning and pitched their quote-unquote pain points. Then over the course of Saturday, that whittled down into these teams that formed organically around the people and the ideas of it that folks, resonated with most. And at the end of the weekend, these teams, there ended up being 16 teams. They all, quote-unquote, hacked their solutions all weekend. We had some mentorship from, folks from the venture capital world, folks from business development, and the FDA, and other, folks with really a wide variety of backgrounds. And they pitched their ideas at the end of the weekend, and we ended up awarding 7 teams, some cash and some mentors and children's simulation lab, and opportunities to interview at various healthcare incubators and accelerators in the Boston area. And it was arguably a pretty wild success. If nothing else, a whole bunch of people at Children's got really excited about opportunities and innovation and developing ideas into real solutions or businesses. So it was compelling enough to do again, and so we're scaling it a bit this year. We're hosting it at the Microsoft Nerd Center, which is this fantastic collaborative space that Microsoft has right on the Charles River in Cambridge. Okay. We're going to have about 150 to 200 folks, and our applications are open online right now, so at hackingpediatrics.com. Okay. But we're looking for really, folks that are excited about helping to change the lives of children and their families, and that could be, docs or nurses or other folks that, or patients or families, people that have issues that they're trying to fix for children. And the folks that can help solve those problems. So engineers, designers, developers, entrepreneurs, folks that have, the background that is not necessarily medically relevant, but that might be able to collaboratively innovate on something exciting.
Well, I guess in medicine they call that crossing the silos.
Yes, exactly.
Going away from medicine, and like I was reading a little bit about you, you said you have to utilize the skills of other silos, essentially, bring them into medicine.
Yeah, it's a multidisciplinary team, on steroids, basically. My belief is that we as clinicians and physicians in particular feel like we know how to do everything. And the reality is that there's, businesses and individuals that are out there that are true experts in their own field, and we ought to leverage their abilities and their expertise and bring it into some things that are going on in medicine. I mean, I think we could all agree that many things in medicine are 20 years behind the curve. And so if we can leverage some of the really exciting things happening in the technology and consumer space, then I think we might have some exciting opportunities.
Well, you know, Mike, I can give an analogy of the same type of thinking. Back around the Korean War, there was no orthopedic specialty. They found out during the war they did a lot of operative procedures on bone, and people, mechanics, carpenters, they noticed that, hey, there's a lot of work for us to do in this bone area. So that's how they created orthopedics, because they found people that had skills other than medical, with the hands, and they started the specialty of orthopedics. That's how it has an interesting history.
I didn't know that.
Yeah, it's a very interesting history, and now, of course, it's a solid specialty. And I really think I have a theory, Mike, that someday there'll be internet medicine will be a specialty, a subspecialty in medicine, where people like you that bring a talent of internet, they integrate it with the medical knowledge, and they leverage it into medicine.
Yeah, I mean, we're making a strong pitch at Boston Children's that our trainees, our residents and fellows, need to learn, about the way medicine is going, and I think, we're all going to be practicing telemedicine in, a year or two from now, if we're not already doing it. We're going to be seeing our patients on our iPhones and iPads before we know it, whether we like it or not. I'm personally a fan of that sort of thing, but I think that we're going mobile, we're going technology, we're trying to hit that, IHI triple aim, and I think, if we can improve the experience and reduce the costs and, improve the healthcare, I think, everyone's going to win eventually. But technology is going to be the way that we get there.
Yeah, I think, certain medical schools, a couple of medical schools now, one at Irvine, I think Cornell and Dartmouth, are basically iPad-based. They're given an iPad the first day of class.
Yeah.
And their lectures are on the iPad.
Yep.
And when they come to class, they interact with the professor. It's no longer the old model of the professor in the front and listening to them. They more interact with the professor.
Yeah. I mean, if you look at the folks coming through medical school nowadays, I mean, these are digital natives. These are young people that grew up with iPhones and iPads in their hands, and they can type faster with their thumbs than they can type traditionally on a laptop or a keyboard. It's a brave new world, and I think that I'm, I guess, young enough to feel somewhat comfortable in these with this technology, but it's I think that's where things are going. So you have folks that are getting comfortable with using all the apps for our world outside of medicine, and I'm trying to argue that we should make our apps for medicine as easy to use and compelling and engaging as the apps that we use outside of our medical world.
Shifting gears a little bit, Michael, how has it affected your specialty of gastroenterology? Has you seen any changes in the practice of it, like radiographs, different quality radiographs, different diagnostic studies, different markers in diagnosis?
I would say, to be honest with you, I would say, certainly in the world of pediatrics, which is, again, a fairly small market when you think about the gastroenterology world on the whole. I can't say that I've seen much of an impact yet, as far as, mobile health or, iPads or iPhones specifically. I mean, 4 years ago, I started an iPad pilot in our GI group, and we use it for just the things that I had already mentioned. We use it for education. We used it for accessing our EMR in somewhat of a mobile fashion, and showing our patient images of their colonoscopy, in the operating room. So we've used it in that sense, but I haven't seen any really robust tools necessarily. Call it, whether it's Google Glass or even iPhones or iPads. There hasn't been any real innovations within GI that I've seen. But as far as telemedicine, things are really changing. Folks within my own group and within children's are really pushing towards using telemedicine more and more for routine follow-up and assessing patients. My colleagues in home parental nutrition program is using it to check in on their patients and assess their home for if it's the right space to be preparing and administering home parental nutrition. So I think there's the telemedicine in particular. I think has real opportunities, in GI and outside of GI as well.
How about the field of genomics? Has there been any advances with the propensity, say, to inherit certain gastrointestinal diseases because of genetic improvements in genomics? Have you noted anything or no?
Yeah, so I mean, I'm a IBDologist, so my area of interest and previous clinical research is in inflammatory bowel disease, and particularly the microbiome. So that's an area that has, even in my relatively short career, is just completely blown up. And I can take this conversation in a whole different direction about, the microbiome and fecal transplants and.
Well, go ahead. It's okay.
So,
it's great.
Yeah, of real interest. I'm not sure how many folks are even aware of the use of fecal transplants for C. difficile, but we've been planning for a study in using fecal transplants in inflammatory bowel disease based on what we know about the microbiome being different in patients with Crohn's colitis versus healthy controls. But the genomics and the ease with which we can study environments and learn about the microbiome has changed, so dramatically and exponentially over the last really 4 or 5 years. It's remarkable. And the same would go for diagnostics. We now can use pharmacogenetics and determine proper dosing of medicines before we even dose medicines. So there's a really it's an exciting time, in medicine in general.
Well, in that I don't even remember hearing, Mike, in medical school, microbiome. That was just something that was not really paid attention to.
Yeah.
Now it's to be getting a lot of attention.
Oh yeah, it's the world I live in now, so perhaps it's not as well spoken about in other fields, but in the field of gastroenterology and in inflammatory bowel disease in particular, it is super hot, and there's a lot of potential diagnostic and therapeutic value in knowing the players that are in your microbiome, because they have tremendous impact on the immunology and physiology of patients, and even people are thinking that there may be impacts on behavior and psychological factors as well. So there's a symbiotic and long-standing co-development between us and our microbiome. It's very interesting.
That's another hour, I think.
Yeah.
Hang out. Yeah. Well, John, you're quiet over there. I'm sorry about the audio problem. Do you have any questions for Michael?
Yeah. Sure. Yeah. If you can hear me, okay.
Yeah.
Yeah, we can hear you.
Yeah. Okay. Yeah, I hear the terms hologenome a lot, or hologenome. A lot of guys I talk to on social media, Jonathan Eisen out of California, talks about it all the time. But back to the programming question. I'm not hearing a lot of Android. And when you program on the iPhone, which to me is very difficult, can you cross-compile for Android devices, or do you have to start from scratch with a high-level language or Java, or how do you do that?
Yeah, so I will be the first to admit that, number one, I am someone that has been an early adopter with Apple devices, so that's what I use. I'll also tell you that I'm a dreamer and not necessarily someone that's going to do the coding. So I work, I've worked with developers I've found on, on Craigslist, and we now have folks at Children's that I work with and outside vendors. They're the ones that do the writing the code. But I will tell you that in the enterprise setting, and certainly at Children's, when I look at the number of devices that hit our internal networks, about 90% of them are iOS devices. I don't know if that's a Boston thing or that's a children's thing or whatever, but when you look at a lot of the things that are being built for the enterprise and healthcare in particular, it definitely has a decidedly iOS feel about it. So, for example, Cerner, which is our electronic health rec, they're coming out with a mobile-friendly version of their software, and it is decidedly iOS and only iOS for now, at least. So, when I've developed things, I have, specifically developed for iOS. But there are some great solutions out there now. I mean, I'll tell you at a very superficial level, from my understanding of, there's things like PhoneGap, and there are, HTML5 based apps that can kind of bridge the gap, so to speak. But it is a challenge, deciding, if you're going to go native, which build on, and iOS seems like it's certainly more work, but might be worth it, especially if you're building for the healthcare environment.
Very good.
Yeah, that's my impression. Like with the Live Core, when that first came out, it just seems the medical field is highly biased towards the iPhone. But from my own point of view, I mean, when I try to get into app development with the iPhone, there's costs, there's unknowns, it's very difficult. Whereas with the Android, it jumped right into building actual hardware devices and writing apps to control them, and it was very easy.
Yeah.
So I'm just wondering, if you're closing doors by staying, not you, but your field.
No. I think you're absolutely right that we have to be, aware and as device agnostic as we can be. It is the dichotomy that's set up between the two, and I again argue that, for our environment at Children's in particular, we have a very iOS-centric environment, and so a lot of the solutions that are already given to us are iOS. I agree, and from what I've heard from developer friends and elsewhere, Android is certainly easier to build for and to play with, and that's both good and bad when you think about it from a security perspective and all the things that the networking folks and the HIPAA compliant people and the folks that worry about the mobile device management and all. It's a very ornery beast to kind of wrap your hands around with Android as compared to iOS. So from a networking and security perspective, which I occasionally dabble in that world, I know that the folks tend to be a bit more comfortable with the enterprise comforts that iOS provides.
Very good.
Oh, you just need Apple to come out with some glasses then.
Somewhat, sorry?
What's that, John?
You need Apple to come out with some glasses then.
Yeah, well, they'll come out with a watch hopefully next week, so that'll be a start.
Yeah, Mike, you don't have any experience with glass, do you?
So personally, I played with it a little bit, and we had a couple of folks at Children's that were building solutions for it, and I was part of Jennifer Jo's Google Glass Challenge, so I was one of the judges on that. My personal opinion on Google Glass, if you want it, is that I think it's a cool technology. I think it's pretty early.
Okay.
And I can't quite yet see myself going into a patient's room wearing one of them.
Okay.
But I think there's some interesting applications that I know folks are working on, particularly in the simulation and education space. I think certainly folks in the front lines have a real compelling application there. So there's a great solution that came out of one of Hacking Medicine's hackathons with the Brigham in Boston, a group called Triage that basically created a Twitter-like app to help triage patients heading to the ER. And first-line responders are using glass and a mobile device to take pictures of the scene and take pictures of an EKG strip and send it to the ER. So I think there are some really exciting and novel use cases for Google Glass, and the OR and all of that. But I think it's certainly not ready for prime time, as far as I'm concerned, for most folks in medicine.
Do you foresee its use in GI education?
Yeah, I mean, I think across the board in education and in whether it's telemedicine, patient to provider, or it's telemedicine provider to provider. I think that there are certainly some interesting cases of where trainee to attending. There's ways that you can kind of be on someone's shoulder, so to speak. Or you're managing a tough case and you need to call in a friend, so to speak. I think there are some really interesting use cases in GI, surgery, ER, any of those. But I don't see this so much as a patient-facing thing yet. I think that the jury's still out there.
But we'll see. Okay, Michael, I really appreciate you coming out tonight and talking to us. And once again, the pediatric hackathon is October.
Oh, you're cutting out a bit.
Oh, I'm sorry.
October 17th through the 19th.
17th to 19th at the Microsoft
Nerd Center. So check it out, hackingpediatrics.com.
Very good.
John,
Okay.
thanks very much.
Okay, Michael, anytime. You're welcome to come back with anything, and just I'll be keeping in touch.
Great. Please do.
Okay, thank you very much. I'm going to stop.